So we have taken care of many neuropathy patients over the years. We actually had two clinics in Florida called the Neuropathy Centers, where that's all we did was took care of neuropathy patients. So neuropathy, about 85% of those patients have diabetes, and then about 12% just come from maybe chemotherapy use or statin drugs over long usage. And then the remaining percentage is called idiopathic, which basically means we don't know where it comes from. So, regardless of what causes the neuropathy, the diabetic patients we do really well with. The patients that have had toxic intervention, whether it's chemotherapy or statin drugs or something like that. Even we had a patient was, in Agent Orange, and that was the quote unquote toxic overload that caused him to have neuropathy. So those patients we do really well with. When it's an unknown source or cause, those patients they're just a little trickier and they require a little bit more treatment back and forth to really get a good result. So here's the basis of what neuropathy is. So obviously it affects the nerves, and nerves carry signals to another nerve, and they communicate to that nerve, and then the signal just carries on. And it's an electrical communication, electrical and chemical communication. A nerve is sort of like a wire. And if you look at you look at any wire, there's always a plastic or rubber, mainly plastic, covering around the nerve. And that's called a myelin sheath in the body. And this regrows and regenerates every 6 to 8 weeks. So what happens mainly with toxic overload, chemo or statin drugs or some other toxicity, and diabetes, is we get inflammation of the very smallest blood vessels, these capillaries. These capillaries feed the myelin sheath that covers and protects the nerve. When the capillaries become inflamed, and this is systemic inflammation. It's not like when somebody injures their ankle and they have a swollen ankle. It's internal, it's systemic inflammation. And because these capillaries are very small blood vessels, the inflammation really occludes or blocks the blood flow. This prevents the myelin sheath from regrowing. So what happens is we have sections of the nerve where the myelin sheath is not regrowing, that becomes exposed to the environment within the body. And without that protective myelin sheath covering, the nerve sort of shorts out. And then we get the standard things. We get burning, pain, loss of sensation. These are all the smallest nerves. This is the initial phase of neuropathy. When we catch it at this phase, it's very easy to treat. As it progresses, the smaller nerves are dying off. That's what's happening. They're actually dying off. As it progresses, the larger nerves, these are thicker, fatter nerves, when they start to short out or die off, then we get an effect on muscle control. This is where we really run into problems with some patients because they lose their balance, it affects their gait, how they walk, how they move around. A lot of times this neuropathy with loss of sensation and loss of muscle control, they have falls and they're injuring wrists and shoulders and hips, and they're breaking things, and it's really sort of a dwindling spiral. So it's not a good picture. It is a progressive disorder, which means next month or next week it will be worse, and the following month or the following week it'll be worse, and the following month and the following week it'll be worse. So what we need to do is a couple of things. Number one, we have to reduce and stop the inflammation, right? Otherwise, we're just sort of putting a Band-Aid on it, fixing it, and then 2 months later we have a problem again, right? Because the myelin sheath is regrowing every 6 to 8 weeks. So first we have to stop the inflammation. That's vitally important, and we know how to do that. We use peptides for that. The second thing we do is we have to regrow the myelin sheath. And the way we do that is we use, again, peptides and regenerative medicine products and a shockwave device. And the combination of those things will force the body to grow new blood vessels from the ones that have been occluded and have sort of withered away. This process is called angiogenesis. So we use nutritional supplements, we use regenerative medicine, and we use shockwave. The combination of that therapy causes new blood vessels. The regenerative product speeds up and accelerates the growth of the myelin sheath. And then now we have a nerve that is starting to conduct as it should. It is protected because that myelin sheath covering is around it, and it can continue to regrow because we restored the blood supply, the very small minor blood supply to those areas while we're reducing the inflammation. So it's a bit of a 4 or 5 pronged approach, again, depending on severity. If we get a patient that only has sensory deficit, they have burning, they have numbness, they lose sensation, they can't feel things, rug or floor, whatever they're walking on. If those sensory components are all that exist and we haven't seen a balance issue or a gait issue as yet, that recovers pretty quickly. When the larger nerves get involved, obviously it's an indication of more damage and it requires a little bit more treatment to get first the sensory nerves, and then we recover the larger nerves, and that will restore muscle control, proprioception, and balance. Proprioception is, if I put my hand over here, my brain, through the nerves, knows that my hand's over here. I don't have to look and see it. It knows it's over here. That's called proprioception. That is conveyed by the nerves. So when you're walking or you have balance issues and your brain doesn't know where your foot is, that makes it difficult to remain in balance. And then the risk for falls becomes pretty high. So we know what stage the patient is at. When the patient comes in, we do a 16-point sensory exam, which is a standard exam for any neuropathy patient, regardless of what treatment they're going to have. They all have a 16-point sensory exam. This includes hot and cold and pinpricks and feather and different sensory components to find out which nerves are not working as they should. And then we use a specialized thermography tool, which will assess blood flow to those areas. And again, it's the blood flow that allows the regrowth and regeneration. And if we see a lack of blood flow there, we know those nerves, whether they're symptomatic now or not, they're going to have a problem down the road. So in many cases, we will see that, right? We'll see somebody has problems with their toes or the bottom of their feet, and we may check their ankles or from their knees to their ankles, and we see the beginning phases of the lack of blood supply. The blood supply is dying off, which means the myelin sheath will not regrow or recover, which means then they're going to have neuropathy. When we see that, we treat the symptomatic area and the potential symptomatic area, and this gives us a really good result. It gives us a long-standing, long-term result. We know really day one through our evaluation whether we're going to be able to help the patient or not. So there's not a lot of question on that. We do a real thorough examination. We compile all this data, and then we let the patient know what we're going to do treatment-wise. Unfortunately, this treatment is not covered by insurance. I wish it were, but it's not covered by insurance. So it's considered a self-pay elective procedure. And with that, the range of price is somewhere from about $5,600 and can go up to, about $12,000, right? I would say the average patient that comes through, it's about a $6,900 program, and that includes all the treatment, all the exams, all the follow-ups, all the products and materials that we'll use to get them over the hump. Actually most of our patients have obviously been, to other physicians, and they wanted to get some help or treatment for their neuropathy. In the standard medical framework, that again, most insurances will cover this treatment, even though it is not effective. That doesn't make any sense to me, but that is the nature in which we live in, right? So when a patient goes and has a neuropathy evaluation from maybe their family care, endocrinology, neurologist, the treatment modalities that doctor, that mainstream doctor, can offer that patient are very limited. Basically, it's medication. The two most common medications are gabapentin and Lyrica, right? These may help with the symptoms. So the patient has, burning and stabbing pains in their feet. It keeps them up at night. So the lack of sleep causes other problems within the systems of the body. So that's a problem. The pain medication, gabapentin or Lyrica, interrupts the nerve's communication to the brain. So the brain doesn't really interpret that there's pain or dysfunction going on. So it's helpful for about 2 to 6 months, and that's about it. All right. Now, what happens when we're just blocking the pain sensations from hitting the brain? Are we doing anything for the condition? Absolutely not. What we're doing is we're covering up the symptom while the problem is continuing to get worse. As I mentioned, it's a progressive disorder. It's going to get worse unless we treat it correctly next week, next month, next year. It's just going to get worse. So the medications are not that effective. They may be effective for giving some patients some relief, some short-term relief. It doesn't come without side effects. And one of the newest reports I read with Gabapentin Lyrica is that the patients that are taking those drugs have a higher incidence of Alzheimer's and dementia. So there's a fairly significant risk with that, other than just the toxic effects it has on your kidneys and liver and some of the other things. So when we see a patient on those medications, of course, we didn't put them on those medications. We cannot take them off those medications. That's against a medical legal code. So we don't do that. But what patients do is, because they realize the medication is either no longer working or carries some pretty tremendous side effects, they go back to their doctor and say, listen, I'm not taking this anymore. And that's fine. And the doctor, if they've been on it for a while and they need to get off it, on a gradient, so they don't stop taking a full dose, and then Monday they take a full dose, Tuesday they stop. It's not the best way to go. Sometimes on a gradient, you cut the dose in half for 3 or 4 days, cut it in half again. The doctor can advise them on that. We don't get into that aspect of it. What we get into is isolating what the neuropathy is being caused by. Again, it's either idiopathic, which we do not know, it's a very low percentage, chemical or toxic overload, or the most common is the diabetic patient. And we're actually seeing with a lot of pre-diabetic patients that even patients that are full-blown diabetes are getting initial symptoms of neuropathy, and they're showing up on our thermography scan that the blood supply is already deteriorating. So many cases, these patients, like I said, they go seek other help. They go to a doctor. The doctor gives them this medication and says, basically, this is all I can do for you. It's a progressive disorder. There's nothing I can do for you. Well, that is one doctor's viewpoint. That's a medical mainstream viewpoint, basically governed by what the insurances will allow the doctor to do, right? Even if the doctor wanted to do something outside of Main Street, the insurance would not cover it. And therefore, most doctors don't want to get into that conversation with patients. And, they're sort of evaluated as to how much on the mainstream they stay, right? So if they don't want to ruffle any feathers, they do the standard protocol. And the communication to the patient is quite simply, you have this condition, there's nothing we can do about it. And obviously, I've been doing neuropathy care for 12 plus years, and we see that we can not only eliminate the symptoms, but reverse the condition. And, there's no surgery required. There's no side effects from our treatment. We use all natural products and supplements, and our peptides are natural, regenerative medicine are natural. They don't produce side effects because they're natural components already in the body. We are ramping those components up to get the effect from the areas that have been dysfunctioning, but there is no side effect with our treatment. There's no downside. There's no risk. There's nothing they have to worry about from a downside or a side effect or anything like that. So that's how we handle the patients that come in and say, listen, I've been to my doctor, says there's nothing we can do. And I let them know that is a viewpoint, but it's not the only viewpoint. There are other options out there. In many cases, patients will ask, what is the outcome of this disease, neuropathy, if I do not handle it? Well, of course, the nerves are responsible for controlling all the tissues and, handling all the functions in that area. If the nerves die, then, the muscles die, the skin dies. A lot of times there'll be wounds that don't recover and things of this nature. So once the nerve dies, everything else sort of heads down a dwindling spiral. And in many cases, it leads to removing that part of the body, right? Unfortunately, my brother-in-law had neuropathy, did not get it taken care of, and he lost his foot. And then it continued on, and then they took his leg just below the knee. And basically, these are dead and dying tissues, and the only way to protect the rest of the body is to cut those areas off. So neuropathy leads to amputation, and it's not. It either leads to amputation, or the larger nerve fibers that control the muscles and balance and proprioception and things of that nature, deteriorate so rapidly the patient can't walk. Ultimately, they end up in a fall, and we're dealing with a broken hip or something else that really becomes a real life-threatening problem. So, but just the neuropathy in and of itself, untreated, you could be taking gabapentin Lyrica for years while you're getting worse the whole time, and then you have to remove that dead, dying part of the body. You have to do, it leads to amputation.